Good morning. First of all, we'll start with an update on the numbers. We had 125 new positive cases for a total of 1,270 positive cases. We had no new counties as of yesterday, so the total number of counties remains at 79. We had 882 negative cases for a total of 13,703 negative cases. We have the capacity to test at the State Hygienic Lab of 2,530 tests. We have 115 hospitalized as of yesterday, 476 recovered for a recovery rate of 38%. And I am sorry to report that we have had an additional 2 deaths, 1 elderly and 1 older adult, both from Lynn County, for a total of 29 deaths. Yesterday, I was joined by the Iowa Economic Development Authority Director Durham to update Iowans on our progress with the Small Business Relief Program. Today, the United States Department of Labor announced that 6.6 million Americans filed for unemployment last week. Here in Iowa, we continue to experience tens of thousands of claims filed weekly. I have asked our Iowa Workforce Development Director, Beth Townsend, to join me today to provide an update.
The number of initial claims reported by the U.S. Department of Labor filed in Iowa between Sunday, March 29th and Saturday, April 4th was 67,187, and the number of continuing claims, meaning second and beyond weekly claims, was 92,952. This includes 3,147 claims filed by individuals who work in Iowa but who live outside of our state. We paid a total of $27,565,232 of unemployment insurance benefits during last week. Most of the claims are being paid in 7 to 10 days from the time of their initial filing. As most of you know, the Coronavirus Aid, Relief, and Economic Security Act took effect on March 29, 2020. So I wanted to give you an update on where we are in terms of implementing that act. The act provided that the Pandemic Unemployment Assistance provides unemployment benefits for the self-employed, including independent contractors, freelancers, gig economy workers, nonprofit employees, and the self-employed. You can watch a video at our website that will show you screen by screen how to apply for these particular benefits. You can also upload the necessary documents to prove and establish your income for 2019 or 2020 in order for us to determine what eligibility you have for unemployment benefits. The CARES Act also provides the federal pandemic unemployment compensation, which will provide an additional $600 per week for everyone who qualifies for a new or existing unemployment benefits, including those who are receiving regular unemployment benefits and those who are self-employed. The start date for this program is March 29th, 2020, and the end date for these benefits is July 31st, 2020. We anticipate these payments will begin to go out next week, and once they do start to go out, we will post an update on our website notifying people. I want to remind you that you cannot voluntarily quit your job in an effort to obtain the weekly benefit or unemployment benefits. Voluntary quits are a disqualifier for unemployment benefits. You must be either laid off in a temporary layoff or have reduced hours to qualify for unemployment insurance benefits. We have been waiving the charges to employers' accounts for all employers who filed unemployment due to COVID-19 related claims. Today we are announcing that we have put in place a trigger so that once the UI, or the Unemployment Insurance Trust Fund, reaches this balance, we will need to begin charging employers with these unemployment claims. That trigger is $950 million. We are currently at $1.13 billion in our trust fund, so about $180 million away from the trigger. None of the benefits from the CARES Act will be taken from the trust fund, so this applies only to unemployment claims that are made by employees with employers in the state of Iowa. Federal legislation has also provided that experiential ratings on businesses will not be impacted by these claims. However, the overall balance strongly affects the federal tax table Iowa employers will be in 2021. We are currently in Tax Table 7, and we believe setting this trigger will help to ensure we do not fall into Tax Table 6. The tax tables affect the baseline tax rates for employers and is therefore key to helping minimize the impact of this event moving forward and spurring our recovery. Iowa Workforce Development continues to receive tens of thousands of calls a day. We're working very hard to answer all of those calls. When you call, please wait for the ringing to stop. You will hear momentary silence, and then someone will answer the phone. We are also working hard to clean out the email box before the end of the day and turning around email responses to UI claims help at iwd.iowa.gov within 24 hours. As the governor says all the time, she knows Iowans we're going to get through this together. I would ask that all Iowans provide the hardworking, dedicated, and committed staff at IWD the same patience and grace they would their friends and neighbors. We may not get to you as quickly as we normally would, but we will get to you, and more important, we will get your claims paid.
Thank you, Beth, for that update, and thank you to you and your team at Iowa Workforce Development for all that they are doing day in and day out to assist Iowans during this incredibly difficult time. We also this week, we have spent time reviewing information about the RMCCs, the Regional Medical Coordination Centers that have been established by the Iowa National Guard, again, to support the Iowa Department of Public Health and our healthcare coalitions by facilitating communication, critical information sharing, and coordinating healthcare resources within a region or across the state. On Tuesday and Wednesday, I shared information about the RMCCs in eastern and central Iowa, where our state's hot spots are located. Today, I want to highlight the RMCC regions in western Iowa. Region number 3 covers northwest Iowa. Currently, this region has 9 counties with no positive COVID-19 cases and a significant number of counties with 3 or less positive cases. As of yesterday, in Region 3, we had 1 COVID-19 patient that was hospitalized. No new patients were admitted in the last 24 hours. We have 1 that was in ICU and 1 on a ventilator. There are 399 inpatient beds, 32 ICU beds, and 51 ventilators available and ready for patient care. And now we'll move to RMCC Region 4, which covers southwest Iowa. Yesterday in Region 4, there were 4 COVID-19 patients hospitalized. No new patients were admitted in the last 24 hours. 3 were in ICUs, and 1 was on a ventilator. And there are 262 inpatient beds, 39 ICU beds, and 58 ventilators still available for patient care. Yesterday, we also had calls and emails from people who were interested in seeing the data again for eastern Iowa. So I want to provide a quick update on Regions 5 and 6. In Region 5, where Johnson County is located, there were 32 COVID-19 patients hospitalized as of yesterday. 7 new patients were admitted in the last 24 hours. 14 were in ICUs, and 11 were on ventilators. There were 702 inpatient beds, 93 ICU beds, and 167 ventilators available for patient care in that region. Region 6, which includes Lynn County, where an outbreak in a long-term care facility has resulted in many elderly adults becoming seriously ill. Yesterday in Region 6, there were 48 COVID-19 patients hospitalized. 4 new patients were admitted in the last 24 hours. 32 patients are in ICUs, and 17 were on ventilators. At the same time, there are 1,002 inpatient beds, 57 ICU beds, and 119 ventilators available for patient care in Region 6. As we are seeing across all RMCC regions, Iowa's capacity to care for COVID-19 patients and available resources are very good at this time. We are monitoring this information daily, and if a situation changes, we're ready to respond. The RMCC model is in place so that we can function as one healthcare system across the state, working together to, again, manage our resources and provide the best possible care for Iowans in need. Even during this challenging time, there are so many good things that are happening in our state. And I want to acknowledge and thank the many Iowans who are stepping up to answer the call to help during this unprecedented time, especially the businesses and individuals that are producing PPE on a daily basis. Iowa's own Department of Corrections and the Iowa prison industries have now produced more than 25,000 masks, 3,000 gowns, 5,000 face shields, and 7,000 gallons of hand sanitizer. Dimensional Graphics, a manufacturer in Mason City, is producing 100,000 face shields that will begin arriving this week to the state stockpile and distributed to healthcare and long-term care facilities in need. I want to again just say thanks to Homeland Security, the Iowa National Guard, the Department of Transportation, and the Department of Public Safety for ensuring that as soon as those PPEs come into the state stockpile, it is being loaded on trucks and delivered to where it's needed. To date, the state has made 353 deliveries across all 99 counties. And finally, everyday Iowans are rolling up their sleeves to help. Tara Carlson from Stratford bought a sewing machine, taught herself to sew face masks so that she can donate them to local care centers. Her husband is a nurse practitioner, so she understands how important it is to protect our healthcare workforce. Tara's also pregnant, and when she can't sleep at night, she gets up and sews. So far, she has made 147 face masks and have donated them all. Tara, I want to thank you and your husband for everything that you're doing to help Iowans during this time. Be safe and take care of yourselves. So if you can sew or face mask for your local health care and long-term care facilities, that is one way that you can help those on the front lines during this pandemic. You can find more information about how to make those masks at coronavirus.iowa.gov. And with that, we will open it up for questions.
Governor, on the PPEs and the equipment, we're hearing now that the national stockpile has been depleted. I don't know if you've heard that yet from the federal government. Has that an impact on Iowa? Is there any orders that you had pending that you might not get? And can you just give us an update on the relationship that you have ordering from that stockpile?
So that's why I'm continuing to highlight the great things that businesses and individuals are doing within our state. We continue to place orders. We have received some have been delayed, so we continue to monitor that. But that's why from the very beginning, this has been an issue for every single state across this country. And that's why we've been proactive. We've had a whole hands on deck, so all of the above approach. And I really am proud to say that Iowans and businesses are responding, and we have to do that until we can build back up our stockpiles, both at the national level and at the state level. So again, I just want to thank all of the workers that are reaching out and coordinating these efforts. And daily, we get so many calls from individuals that are saying, what can I do to help? How can I retrofit? Where do I need to go? Who do I need to talk to? I want to step up, and I want to be a part of that. And that is anywhere from individuals like Tara that I just mentioned, all the way to bigger businesses that are reaching out and digging deep and really playing a role in helping protect those individuals that are standing on the front line to keep all of us safe and healthy.
Do we have enough equipment, do you feel? I mean, is there enough for the hospitals?
The PPE is going to continue to be an issue. So right now, we're monitoring it very carefully. We're getting the needs where they're at, but I put the plea out, help us, so we're going to continue to monitor that to make sure that we can continue, especially as we talk about, additional people wearing face masks and doing additional steps to protect individuals. So we just can't let up for a second. We need to continue to dig deep, do our part, and answer the call.
Question about the point scale for the different regions. When a region reaches 10 on that point scale, is that an automatic trigger for a shelter-in-place order for that region? Are there any automatic things that happen when that threshold is reached?
So we're looking at that, and as we see some move into a 9, we're looking at what additional steps need to take place to help continue to reduce the spread of the coronavirus, to make sure that we're flattening the curve, and most importantly, that we're doing everything we can not to overwhelm the healthcare system. And so we have a series of next steps that we're looking at, and we're looking at it from a regional perspective. We're also looking at various counties, we're looking at various communities, so we're collecting all of that data. And but first and foremost, we really can do what we need to do by Iowans following through what we've asked them to do. And that's how we protect every Iowan. And that is stay home. Only go out for essential things like going to the grocery store, going to the doctor, picking up medicine. If you go out and exercise, do it responsibly. Practice social distancing. Don't gather in groups larger than 10 people. If you are sick, isolate yourself and stay home. If someone in your household is sick, isolate your family and stay home until you've, recovered from the time frame that the Department of Public Health has asked people to stay at home. If we all just, again, dig deep and practice and do what we've asked you to do, we will continue to see the curve flatten, we will start to see the numbers drop, and we will start to talk about how we dial back up this economy and how we start to open things back up instead of talking about how we close things down. So if Iowans will do what we've asked you to do, and especially by doing that, protecting, those healthcare workers that are on the front line, our first responders, our people that are in grocery stores, our truck drivers that are delivering foods, our food supply chain. If you do your part to protect them, we will get the results that we're looking for, and we will start to have a different conversation about how we open things back up.
Governor, if I heard you right, you said we have 2,530 the testing capacity at the state lab.
Yes.
Which, just going by memory, I think is significantly higher than you have said before. In light of that, are you now able to allow testing for more people? And then I think it was last week you said we might be getting the mobile testing and such. Where are we on that?
Yeah, so what you're seeing too is I think you're seeing more and more patients that are going to their own physicians that are getting the test done, and that's happening by not only the national labs but other sources. We have hospitals now that can administer the test and get the results relatively quickly, then sending them out to national labs that has a little bit of a lag time. So it's better at the state hygienic lab. We can get those results in about 24 hours, so it's more relevant. This the timeliness of it. And then the state hygienic lab did get the 15 Abbott machines where you can get the positive, negative in 5 minutes. We have a limited number of tests right now. I have asked, because of the significant uptick, for some additional machines and some additional tests. I think we should be getting them today so that we can start to, again, really target, especially some of these long-term care facilities. And we'll be working with, Dr. Badati and the Department of Public Health to see where we should be utilizing the machines that can test, get the results in 5 minutes fairly quickly. And then we're constantly looking, and so they also are doing this at the national level, just ways that we can do additional testing and really broaden kind of the information that we're able to utilize as we move through this. And I think that'll be really important too when we start to talk about opening things back up.
Just to clarify, the additional machines and that you're asking for, would that be done out of Iowa City or is that spread around?
They are mobile. I don't know if you want to weigh in, let me know. They are mobile, so they can go to different places. And then they can actually conduct the test there, is my understanding. Okay.
You know where there will be?
Well, no, but they're going to collect the metrics. They're looking at the data. That's what public health with everybody. The metrics that we're collecting, we can start to identify where some of the hot spots are. Do you want to talk about maybe how else you would utilize them?
Sure. So Dr. Padati and Dr. Pentella from the State Hygienic Lab, there's a nice blurring of the names there. They are looking at areas of the state where we think that these machines will be most beneficial. And so one of the things we're looking at is, long-term care facilities. And so if we have a concern about a particular long-term care facility, that seems to be an ideal place where we could deploy one of these machines, do some rapid testing, get some rapid results. And so we could, if there was a concern about a particular facility instead of having to wait 24 hours to get a test result, and we will be able to deploy them. And so that's kind of the way that we have initially, anyway, envisioned using those machines. Is there do appear to be concerns in particular areas that they could be easily deployed, so we can get some information very quickly about what's happening in those areas.
Last question in here.
Well, so if you have that capability, couldn't you start testing everyone at a long-term care facility when a case of COVID-19 arises, and shouldn't everyone be tested to?
Well, eventually, hopefully, we'll get there. We're just not there. So we have the extra 15 machines that are mobile that allows us to get some of those results. Right now, there was a limited number of tests, just like we started out with the state hygienic lab that came with those, but we have more coming in tomorrow. We'll continue to request increased testing materials so that we can do that. And really, to Sarah's point, get those where we need them so we can, especially, we know how critical it is to identify a potential issue in these long-term care facilities, and the quicker that we can find out, isolate, make sure they're doing the contact tracing so we can identify and, where the problems might be, they'll become, useful from that perspective. So we'll continue to, hopefully, as we ramp up the test kits, be able to utilize those even more.
All right, we're going to go to Rachel Drozey at Channel 5.
Hi, Governor. We are wondering if you are encouraging the general public to wear face masks in public here in Iowa, and then also if you could give us an updated number for each region.
Okay, on the statistics, I'll let, I forgot to bring that, so Sarah will give you that. I think she's got it in the binder. But, that's kind of like a secondary, what we're encouraging every Iowan to do when they're out and about, to practice social distancing first, limit your trips outside of the home. If you have to work outside of the home, then practice good hygiene, practice good measures and social distancing, and then, have that with you. So if you come into contact, or if you're not able to social distance, then you're able to put the mask on. But really the first priority would be to social distance, to limit, only go out for essential services. If you can work from home, work from home. If you can't, practice good hygiene, social distancing, disinfect often, and potentially then if you can't do that, then you have a face mask there ready to utilize. Oh, okay. Thanks, Sarah. I remember to bring that tomorrow. So, Region 6 is at an 8. Region 5 is at a 9. Region 2 is at a 7. Region 1 is 8. Region 3 is at a 6. And Region 4 is at a 6.
Next question, we'll go to Todd at KCCI.
Governor, I'm not sure if you or Sarah would be best for this, but we've gotten some emails and calls about, will we be doing any kind of antibody testing in the state, and will that be some metric to decide, how fast we can get back to normal?
Yeah. It'll be really important, I think, as we start to, again, talk about dialing things back up and moving towards bringing the economy back online, but I'm going to let Sarah answer that question.
Yeah, Todd, thanks for the question. That is actually something that we are really excited about. But it goes to testing supplies. And so, testing supplies are going to be necessary so that we can do that sort of antibody testing. But I do think that it's something that we see a lot of promise in, especially as the governor talks about kind of being able to reopen things. That presents a possibility for us to be able to analyze people that might not otherwise have been tested, who might have been mildly ill, who might have followed our guidance all along to stay home if they were feeling ill and they weren't able to get a test and they've recovered. And so the antibody testing is something that we think is part of the future of our response to this particular pandemic. And so we're really looking forward to learning more about that and to having the supplies become available so that we can start to employ that in our state.
James Lynch at the Cedar Rapids Gazette.
Good morning, Governor. Looking ahead to the June 2nd primary, Secretary of State and county auditors are encouraging mail-in voting. And I'm wondering if you're hearing from any quarters, the parties, campaigns, or candidates, that the election should either be postponed or conducted entirely by mail. And are you confident that voters and poll workers will be safe at the in-person voting sites?
I don't think at this point there's any need to cancel the June primary. I know the Secretary of State has been very proactive. I have complete confidence in the Secretary of State and the local auditors all across the state of Iowa to conduct the elections with integrity as they have always done. So right now we're going to continue to we're going to continue to monitor the data. We're hoping we're going to continue to see kind of that consistent kind of flattening of the curve. And we're hoping that we can start to see a decline after we get that peak, and then we can start talking again about how we start to reopen. And we'll kind of reevaluate. Well, we reevaluate every day, but a lot of the orders that I put in place go through April 30th. So hopefully by then we'll have a better sense of what things look like.
All right, we're going to hear from Nick at the Des Moines Register.
Yeah, thank you for the time, Governor. You previously cited the matrix as kind of a guidepost for mitigation efforts and when those should be ramped up. And now you're also saying that it's an element. There's other aspects that you guys take into consideration. What are some of the other things that you were taking to consideration aside from the matrix?
Yeah.
And then also in regards to unemployment, have we seen a similar surge in Medicaid applications?
Yeah, we're watching all that. I think sometimes everyone is getting so hung up on the metrics. Let's go back to the main message that we have said since the beginning of this, and that is stay at home, avoid exposure. That is how you can keep from getting exposed and you can keep from exposing others. Only go out for essential errands. Again, it's grocery store, doctors, prescriptions. Go out and exercise. Do it responsibly. Practice social distancing. Don't gather in groups of more than 10. Work from home if you can, and if you're sick, isolate yourself and stay home. That's what Iowans need to be focusing on. We need you doing that. We need you doing that right now. We need you doing that to not only protect our healthcare workers, our most vulnerable Iowans, so that we can flatten the curve, not overwhelm the healthcare system, and that we can start to have a different conversation. So what I would like everyone to do is to help me elevate that message. Help me raise the volume. Practice neighborhood in a good way, not in a bad way. Neighborhood watches where we encourage everybody to social distance, to do the right thing. If we do that, then these press conferences can be about how we can start to open things back up and get this state and this country back to normal. And so let's focus on what we need to be doing, what we can do by being individually responsible. We all have a role to play. We can change the narrative. We can flatten the curve. We can get through this together if we all do what we need to do. So let's focus on that.
We got time for 2 more questions. Lynn at Iowa Capitol Dispatch.
Hi, Governor. Kind of going back to the conversation about PPE, and especially since the national stockpile is depleted, I was just wondering if the state is bidding for PPE against other states and the federal government, and if we fail to get equipment because we've been outbid?
No, it's just we're all out there putting out contracts, requesting for PPE on all different levels. Department of Administrative Services doing that. Our individual agencies are doing that. Homeland Security is doing that. We're accessing through our state stockpile, the national stockpile. In addition to that, we're reaching out to businesses and business and industry and individuals. So everybody from the very beginning has been out there going through the same procedures to try to, make sure that we have sufficient personal protective equipment to take care of those that are on the front line. So everybody is out there doing everything they can. It's just we're short supply. It's just a reality of what we're dealing with, and so we are all doing everything we can in every single state across this country to make sure that they can take care of the people that are standing on the front line, our heroes during all of this, taking care of Iowans. So every state is doing the same thing.
Rod, Lee News will get the last question.
Yes, thank you, Governor. On March 29th, the expectation was that Iowa's outbreak would peak in 2 or 3 weeks. Since we're almost 2 weeks out from that projection, does it look like the peak is coming next week, or are you having to push that back later into the month? One projection out there puts Iowa's peak at April 29th. Does that look like a likely outcome? And if so, would that prompt you to move back the reopening of some Iowa businesses beyond the April 30th date in your emergency orders?
Yeah, we're looking at it every day, and I've said even with schools, we talked about it yesterday. One of the questions I got was when we were going to inform schools what our intentions were for the rest of the school year, and I said we would look at that 2 weeks out. So we're actually evaluating the data every single day, all through the day, but I'm going to ask Sarah to talk about kind of the potential peak and what that looks like.
Yeah, thank you. So what all of the mitigation efforts that we have been trying to put in place, that we have been out here day after day asking all Iowans to do, the goal of all of those things is to really flatten the curve so we don't see a peak in cases. And I can tell you, when we're looking at our epidemiological curve, it is starting to flatten, which means that Iowans are listening. And that means that also it's time to continue to do those things so that we don't start moving in the wrong direction. And so our projections about that haven't changed. All along, we've said last week was going to be a week where we would continue to see increased case counts. We've said the same thing about this week, and that's remained to be true. But what we can tell you is that we are starting to see our curve kind of flatten out, which is exactly where we want it to be. And the reason that we've seen that and the reason that we've been able to do that is because Iowans are doing what we're asking them to do, which is stay home as much as possible. Social distance if you do have to go out of your home. Leave only for essentials like groceries or going to the pharmacy. If we can all continue to do that, hopefully we'll continue to see a flat curve, and then we can get to the point of antibody testing like we talked about earlier. And then we can get to the point of talking about, reducing some of the mitigation strategies so, as the governor has said, we can start to get our state back to normal. But right now, what Iowans are doing has been incredibly helpful, and we want you to continue to do all of those same things.
Could not said that better myself. That's exactly right. We can do that. We can do this. So in closing, I want to recognize this holy time as Easter and Passover celebrations begin today. I am asking all Iowans to join together in a day of prayer for protection, healing, grace, and peace. This has been a challenging time for all of us, but with God's grace, there is always a promise of hope. Today, I will be praying for you and your families, for our healthcare workers, our first responders, our essential workforce, including those in manufacturing, food production, transportation, and our grocery store workers, for keeping our supply chain up and running, and for the strength of our state. So God bless each and every one of you. God bless this great state of Iowa. And I promise you, if you keep doing what we've asked you to do, we are going to get through this together. Thank you.